So before starting with the actual webinar, I would like to take you all through about our quick introduction about our skills for med. This is for the benefit of the newcomers who have joined our webinar program. About us, we have been established since the year 2018, and we have been committed to provide comprehensive training programs for the nurses to empower them and to uplift in their nursing career professional. And for now, we have 10,000 nursing professionals who have logged in into our upskilled by our programs, and 25 plus courses have been launched, and 35 plus hospitals are getting benefit out of our programs. And what is that Skills for Med logo speaks about? This is about our Skills for Med learning pyramid. We have 4 stages. Each stage has each step for the healthcare professional. Like stage 1, when you get into the healthcare, into the hospital to work as a professional, you want to have a basic skills which is required. That is called service excellence skills. And that is for example, we will be covering about the communication and professionalism, etiquette, and also about infection prevention basics in order to run your life in the healthcare field. And when you have completed the stage 1 program, you will be going into the stage 2. This is especially for the nurses and the people who are connected with the procedurals. That is core patient care skills. Here we would have heard a term called competent. It's competent in sense you're competent in one kind of procedures and not all other sets of procedure. Here the ideal thing where we are focusing on all the procedural skills, where after attending to this program, a nurse will become a clinical expert. And coming to the clinical expert, it's not enough. So still she has to go move a way forward. He or she has to move a way forward. That is stage 3. Stage 3, we are focusing on specialization skills. Once you have become clinical expert, it's time to identify your own specialty, where your strength is deep rooted in. Either you might be already working in the labor room, you wanted to achieve a specialization role, then you have to do the labor room's upskilling program, or you have selected the profession to become an infection control nurse, then you have an opportunity to get a certified program like an infection control nurse program. And also we have the clinical instructor program, not just as a bedside, you also equally have a vision to train the nurses. This is another opportunity. And we have a lot more specialization course emergency room upskilling program, and also about the critical care nursing program. And once the specialization done, you have achieved the service excellence, become a clinical expert, and you have become a specialized nurse. Now it's time to focus on your leadership role. Leadership, that is divided into 2 things. One is the vertical path which you are looking in your own hospital, becoming a senior staff nurse, in charge, supervisor, and the aiming for the ANS, DNS, and CNO, which is the vertical path, is as usual what you're looking at now. So there is another path which is lateral. All the nurses are capable in handling a lot of things, which is what are all the issues or coming up in your unit. You are able to you are capable to answer to that, or you are able to give the solution for all those things. What I see is nurses are very strong in all aspects of field in healthcare system. So you can jump into the operations, which is the lateral growth, where you can have a vision towards to become a CEO of the hospital. That is something called as nursing management course. So that is what the stage 4 is about, either as a nursing leadership or as the nursing management. So this is which is about the Skills for Med learning pyramid. And here is an announcement about the infection control nurse program, which is Skills for Med collaborated with 𝐏𝐫𝐨𝐧𝐭. We are providing this comprehensive program. The course highlights are 2 really good to run the show for it, and we are running in the special offer 17,700 inclusive of GST. It's a self-paced learning, and we have seen many nurses who have transitioned their career as an infection control nurse after completing this program. And to know more about our course details, you can contact Ms. Jayanti, and her number is on the display. And to know more about our courses, you can even visit our website, which is www.skillsformed.com. I'm sorry for the delay. We have come to the webinar part, like building a culture of hand hygiene compliance in Indian hospital. As Mr. Rajaram have said, this is our final series of this webinar. And I here welcome Dr. Parivalavan Rajavelu. He is our consultant surgeon, Sundaram Medical Foundation, and he is the founder of For the Skills for Med. He is the leader who has a great vision for the nurses to upskill them by the structured program, and he is the person who has a great vision for the nurses towards the year like 2047. And he is a passionate advocate for healthcare quality. Dr. Parivalavan plays a key role in 𝐏𝐿. He contributes as a mentor, national speaker, and he is a GC committee member and serves as a chair of EndoSafe, actively promoting endoscopy safety across India. His leadership is deeply rooted and he is like extensive in his clinical experience, ongoing research, and international presentations. Through Skills for Med, he continues to advance healthcare outcomes by equipping professionalism with real-world skills and practical knowledge. Dr. Parivalavan's unique blend of clinical skill, academic rigor, and system-level thinking makes him an inspiration and change maker in today's healthcare landscape. We welcome you, sir.
Thank you, Stella, for the kind introduction. Shall I share my slides now?
Yes, please, sir.
Okay, good afternoon, everyone. Gives me again great pleasure to be here on the Friday afternoon webinar, which we have been doing for more than, it's almost going to be 2 years now, I think. Every Friday we are here, talking about some aspect of patient safety, nursing excellence. And this last 5 weeks, we've been talking with experts all over the country about the infection control measures that they are implementing in the hospital and sharing with us. So the last topic is, they always say, the last but not the least. So this is, 1 minute, let me, just a minute. Yeah. Are you able to see my presentation?
Yes, sir.
Okay. All right. So the last of the presentation is about hand hygiene, and this is again needless to say is the 20-second miracle. By the time it takes you to wash your hands properly, somewhere in the world a life could be saved from healthcare associated infection, because that is the number of patients suffering from healthcare associated infection. And it has been proven again and again that this particular procedure, which just takes 20 seconds, can save a lot of lives. Some problem with the, I don't know why my screen is paused. 1 minute. Yeah. Can you see the next slide? Okay,
Yes,
so
sir.
this is the, as I said that, 20-second miracle also becomes a 20-second challenge. So just this particular act of either putting a hand rub on your hand or putting soap and water on your hand and doing that hand hygiene has remained one of healthcare's greatest challenges. WHO has time and again reminded us that this is the most important way to prevent infections, but still, we are lagging behind all over the world. So the solution is in your hands. Now the pun is intended. So healthcare associated infections affect 1 in 10 patients globally, and 50 of or even 70% of these infections could be prevented with proper hand hygiene compliance. And why are we so worried about this? No, HIIs, we have been talking about this week after week for the last 5 weeks. It affects 1 in 10 patients globally. And as I said, it could, hand hygiene is one particular intervention which could prevent a majority of these infections. But compliance rates or stubbornly not will no moving. It just stays there and refuses to move. So let's see today. We all know what to do, and we are not going to talk about it. Okay, and we are going to understand how to create a lasting stage. So that is the intent of today's webinar. So the science is clear. WHO, has put up the 6 steps of hand hygiene, and this is taught everywhere, and in every hospital. And it's maybe the minority who doesn't know about the 6 steps of hand hygiene in any healthcare system, and it takes a minimum of 20 to 30 seconds to perform this. And also the science regarding when you should do it. So the 6 steps is how to do it. The 5 moments is when to do it. So there is before touching the patient, before a clean aseptic procedure, and then these are the 2 befores, after touching the patient, after bodily fluid exposure risk, and after touching the patient's surroundings. So 2 before and 3 after is what you got to do the hand hygiene. So this also is clear, and I don't think
Hello.
arguing about this.
சத்யா அது ரெடி ஆயிடுமா? ஏன்னா நான் ஆக்சுவலா என்னோட அனௌன்ஸ்மெண்ட்ல பண்ணலாம்னு நினைச்சிருந்தேன்.
Stella, can you mute yourself?
So I'm very sorry for this.
Okay. So let's come to the uncomfortable truth. So the global compliance rates in developed countries again varies between 40 to 70%, and developing countries are lagging behind it. So I've taken the median. So this is what is the statistics. And when we come particularly to India, again, it is follows that of the developing countries. And there have been several studies regarding hand hygiene in the past 5 years, which I looked through before this particular presentation. The most important message is it actually the complaints rate varies by the facility type. So if it depends upon the small, medium, or large healthcare, and whether they are tertiary or into quality improvement and promotion, then the compliance rates are higher. But on average, this is what is the poor compliance rate which is there for hand hygiene in India as well. So we had a glimmer of hope in COVID when all of us were really scared about us getting COVID. So we all went and did this hand hygiene very religiously. So you could see how this COVID pandemic effect happened. The hand hygiene rates in all developing and developed countries spiked to about 80%, 70%, and all that. And then once the fear of COVID was over, we were back to normal. Now back to the same old, 20 to 45% in developing countries, and up to 40 to 60% in developed countries. So there is also a lesson in this. So I feel it's if we are the victim, then we seem to be very religious about it. As long as the patient is the victim, we seem to be casual to this approach. So this is a very important lesson which we need to take while training our staff regarding complying to hand hygiene. So it's not now what happened in COVID was the crisis. So everybody focused on the crisis and did hand hygiene. But what we are talking today is the sustainable culture. How, without anything frightening us, how can we improve the hand hygiene? And this is the paradox. And this is the reason why people cannot understand why this 20-second habit remains so elusive. So that is the question, and we hope we will get some answers to this from Dr. Sagar today. So I'm just going to cover very broad things about culture and why these barriers are preventing us, and then hand it over to Dr. Sagar. So you could look at individual barriers, which is preventing this compliance, system barriers, and cultural barriers. So there are several ways to look at it. I am choosing to look at it in this 3 domains. So the individual level, one excuse is my hand is very sensitive. It causes hand irritation, skin damage. So that's why I don't do it. Forgetfulness is saying that so busy that I forgot to do it. And no, I'm careful. No, I do it all the time. But actually, when you monitor and do the audit, people don't do it all the time. And of course, definitely, the time pressure and the stress of work and workflow interruptions do play a part. We can't totally blame the individuals for not being, careful about hand hygiene. So then you come to the system level. So inadequate supplies or inconvenient placement. Several times, I have taken photographs in my own hospital of the, hand hygiene dispensers being empty, and so these sort of things still happen. Poor facilities design. Most of our hospitals were built, in the era when this was not a priority. So putting these, there is one hospital which didn't have a wash basin at all in any of the wards. This was built, years ago. So for them to bring the plumbing lines and create a wash basin in each and every patient area was a lot of resource which needed to be spent. Insufficient training and reinforcement is another cause, and lack of accountability. Who is actually going to be the person who, unless we take individual responsibilities, nobody can be responsible or take account for this particular procedure. So cultural is the most important issue. So always now we think that this won't happen to me. In any type of medical errors, it could be surgical errors or any sort of errors. This is the main block. No, people think that it won't happen to me. That's the reason people don't wear seat belts, don't wear helmets, or even if they wear helmets, they don't clip it because this mentality of it won't happen to me. And then there are hierarchical barriers. Even if the younger person wants to do it, the senior person doesn't either approve of it or is not a role model. So we have competing priorities, and this particular simple 20-second procedure gets overwhelmed and gets buried, and and doesn't become a culture in every one of our healthcare organizations. So I just want to end by just giving you some thoughts about what is culture. We keep on telling hand hygiene culture, safety culture, and all these things. But it's worth just exploring what is culture and how maybe that understanding will help us to put some things in place. So, culture is not what we say, culture is what we do when no one is watching. Okay? When no one is looking at me, am I still putting that hand together for the 6 steps? And am I still doing the hand hygiene in the 5 movements? So, when that happens, when every member of our healthcare organization starts to do it, without some infection control nurse coming and auditing and all these things, then only it becomes a culture. So this is something which is very. It looks pretty. What can I say? Very high to achieve, but I think hopefully we should achieve it, and then things will be in a different plane. So in the healthcare context, if you look at any healthcare system, either it is a single hospital or a group of hospitals, a culture of that organization is the shared belief which everyone has, the values they follow, and the behaviors. So, a combination of beliefs, values, and behaviors will determine how things are done in that particular healthcare system. And this culture will come out when it is done even in the moments of pressure, fatigue, or competing priorities. So, what we think is important, we will do it in spite of all these competing priorities. So this is, I think what every healthcare organization is struggling to put in this culture so that it becomes a habit and not something which we need to be reminded about. So I like, Seth Godin's very simple framework. Seth Godin is a famous author and marketing specialist. But more than that, I really like the way he talks about things in a very simple way. So when you talk about culture, he talks just simply this phrase: "We are people like this, and we do things like that." So if you come to my hospital, my no healthcare workers will say this: "We are people like this, we do things like that." And when you come to your hospital, you are saying that, and that is your culture. Very very simply put, and that's the reason I like that. So if you transfer that framework to hand hygiene. So what is that culture will be? We are people who value patient safety above convenience. And we do hand hygiene for all the 5 moments, even when no one is watching us. So this is something which we need to remember. As you know, you can't just remember and do it. It should be internalized. And if this is internalized, then definitely the culture of every healthcare professional or worker in a particular hospital will start doing hand hygiene. So it's not for our convenience. It's not because somebody is watching us. Because we value the patient and patient safety. So when you look behind the science of culture, no, I'm not going to go into a big talk about this, but everybody talks about, no, it takes about 3 weeks to form a habit and double that time, almost 3 months, not 3 months, 66 days to make it automatic. Most of the physical training gurus and habit specialists quote this particular statistic. So it just takes 3 weeks to form a habit. You have to keep doing it every day. So that when you start drinking tea at 10 o'clock every day, by the third week, you are at that 10 a.m. That tea or coffee, desire comes in you. So that is the habit. And if you do it for about 60 days, that is just more than 2 months, then it becomes automatic. You'll get out of the chair, go to the coffee vending machine or tea vending machine and start having the tea without even thinking about it. So it looks very simple, but that is, in hand hygiene, we're still struggling. So they say that three things are necessary. One is a cue, that is a visual cue of how to do hand hygiene, and contextual cue, whether it is in the ward or at the entrance to the patient room or at the point of care. We need to have this hand hygiene dispensers there. So that is the cue. And then we need to train them on the routine, 6 steps and 5 moments. That I think we are doing. And the reward is the problem. So what is in it for me to do the hand hygiene? No, that is the problem. So it could be an immediate reward where people are now trying to have the light turning from red to green when you dispense the hand hygiene, showing that you have done something good. So something like that. I'm just giving an example. Or it could be delayed where that person who consistently done hand hygiene is being celebrated in the ward. So there are several ways in which you can do it, but personally internalizing that, okay, this routine I have done and the reward is actually I am promoting patient safety is something which has to come, and that is the reason I think this is not getting successful. So the other way in which you can influence modeling is monkey see, monkey do. So you can see in this experiment when the small monkey will just imitate the human, not fully understanding why they're doing it. So maybe this is the reason. Now we keep on telling role models, role models. So are we telling them the understanding of why it is done? So all this is necessary. So role modeling is necessary. Okay, peer modeling and role modeling is necessary. It saves lives, no doubt about that. But just role modeling is not enough. You need to teach the why and then role model. Now, why is that you have to do the hand hygiene should also be emphasized by training and reminders, and then also be a role model. So everything helps. Okay, so that brings me to now this issue of senior consultant using hand sanitizer will inspire the junior staff, and because you this is the normal behavior here. You are sending a message that this is the normal behavior when you enter into a patient care area. We have to do hand hygiene, but sometimes this also doesn't work. So we need to make the compliance visible by role modeling and create discomfort around non-compliance. So how we do it now depends on each and every healthcare organization. So that brings us to the last point in how we can change behaviors is system thinking. So you cannot solve a problem with an individual solution. Now this is what the very basis of system thinking. So it happened. We had a long discussion why people are not doing the hand hygiene, and came up the idea. Oh no, we're having hand sanitizer only at the ward entrances. Let us put hand sanitizer every bedside. So the considerable expense the hand sanitizers were put in the bedside. But that didn't work, because it's just one particular chain doesn't work. Everything has to be connected. So staffing levels also is a problem. The time pressure is a problem. The shortcuts which people do, even though the sanitizers may be there, is also a problem. So systems thinking is looking at all these problems and creating a sort of three-dimensional environment in a particular healthcare organization where all the systems are promoting towards this particular habit. So, that's what I said. No, you need to look at habit formation cycle. I told you, the cue and the have, the routine and the reward. We need to look at peer influence network and role modeling, and you also have to look at the systems map. So all these work together, and this is what is known as multimodal approach, and this is what WHO also promotes as in when they talk about change management. So with that, I think I will stop and just leave you with one particular framework which has this acronym culture. All of us know these steps. What I've done is just put together it in this acronym. So we keep talking about culture. So how do you change culture? Starts with commitment from the leadership. Without that, nothing will change. So that is necessary for the culture change. Next, understanding the why behind every action. I think this I emphasized. The L is leadership, modeling, and accountability. So both leaders, healthcare, whoever is in the ward, either it's a nursing leader or doctors, should model and be accountable for that particular area for the hand hygiene compliance. And T stands for training that transform mindsets. So this is the problem. No, the training just only transactional. Very few of our training is transformational. So we need to see how we can make our training transformational. And the U is ubiquitous resources and reminders. Wherever you turn around, you need to have these resources for hand hygiene, and you need to have the reminders to do hand hygiene. And R is for recognition. So always know when you have people who are doing it religiously, you recognize them and reinforce this positively so that the others also will copy them and do the same thing. And finally, the E stands for evaluation through continuous audit and feedback. So this is a nice acronym with the word culture, giving you a framework of how to implement any culture. Now here we are talking about hand hygiene in a healthcare system. So thank you for this time given to me, and I now want to end by saying that compliance to culture is a journey. It takes time. We need to be patient. So, but we need to be consistent, and we need to have programs like this, which will inspire us when we go back to the bedside today. So, thank you, and I'll now hand over to uh, Stella for introducing our speaker.
Yes, sir. Yes. Um, yeah. So next, this is the time to welcome our speaker. We honor to welcome Dr. Sagar Chandrakar, a clinical microbiologist and infection control officer at Aditya Birla Memorial Hospital, Pune. With over 8 years of experience, he brings deep expertise in diagnostic microbiology, antimicrobial stewardship, and healthcare-associated infection prevention. He holds an MBBS and MD in microbiology and is certified in infection control. He led hospital-wide infection control programs, outbreak investigations, and quality improvement initiatives, including successfully reducing CLABSI and CORTI rates by 20%, which is so remarkable. He also served as assistant professor at Sri Shankaracharya Institute of Medical Sciences and previously worked with Infect-Exin Laboratories. He is trained in ISO, hospital infection control, and antimicrobial stewardship from JIPMER. An accomplished researcher, he has authored multiple peer-reviewed publications in microbiology and infectious diseases. His contribution have earned him several accolades, including silver medal in 𝐏𝐿 National Certification and awards for best oral paper presentation and AMSP quiz performance. Welcome you, sir. So we are so glad to welcome you for this to share this webinar series with us.
Thank you, Stella. Shall I share?
Yes. Yes, sir. Yes.
Is it visible?
Yeah. Is it possible? Can you make that into the full screen?
Yeah.
Yeah. Yes, sir.
Thank you, Stella. Good afternoon, everyone. It's truly an honor to be here today as a speaker for this important webinar on building of a culture of hand hygiene compliance in Indian hospitals. At the outset, I would like to extend my heartfelt gratitude to Skills for Med and 𝐿 for organizing this platform and giving me the opportunity to speak on a subject that lies at the very core of patient safety and infection control. Hand hygiene. We have been talking about this thing for a very long time. A very simple thing, but a very effective to prevent infection. It does not one protects only the patient, but even us, the healthcare workers, by preventing transmission, cross transmission, and controlling the spread of multiple resistant organisms. And yet, despite all the importance of hand hygiene, the compliance.
Sagar, I think you need probably bring the mic a bit closer. I think people are saying that they're not able to hear. Yeah.
Am I audible now?
Yeah, better. Thank you. Thank you.
Thank you, sir. So even after being a very simple thing like hand hygiene, which is very effective and affordable, which can be done by everybody, still the compliance rate around the world for that is very, very disappointingly low. So over the next few minutes, we'll discuss these barriers. Sir has already spoken about the barriers to hand hygiene compliance. So in brief, I will talk about it and explore the means to build a culture where the hand hygiene becomes a way of thinking, a way of caring, and a way of working. So these are the factors of hand hygiene non-compliance or the poor hand hygiene compliance. It can be divided into two types, that is the individual and the system level. I have divided the individual level to further into behavior and the non-behavior factors. So sir has already talked about it. So I will just tell only the headings like the low risk perception from a staff or the work habits of forgetfulness or about the attitude, motivation, peer influence and social norms, fatigue and time pressure. Then the non-behavior factors such as lack of awareness or training, irritation against the ingredients which have been used in hand hygiene products. Then system level factors which are inadequate infrastructure, poor supply chain, workflow design issues, lack of role models, high patient load, staff shortage, inadequate training, and no monitoring of feedback. What I would like to tell in brief is, most importantly, is both these factors, that is individual and system level factors, are not separate from each other. They're not independent. They're actually bound to each other and they strengthen each other. So if you have to build a culture of hand hygiene, what you need to do is strengthen the systems and shape your behavior. So after in any institute or any hospital, when you're working about hand hygiene, first you need to find out what are the reasons for your non-compliances. And you can divide these reasons for non-compliances into these two different segments. That is, either they are individual factors or system level factors. Depending upon what kind of factor it is or what your problem is, you have to design your solution. So in next few slides, I'll be talking about the solutions to this problem. The first one is improving the accessibility. It is a very basic thing. It's a first step, very foundational step, and anybody can do it. But still, it's a step where most of the hospitals still find difficulty. The reason being, it's a very old hospital, where it is very difficult to change the civil structure of the hospital. Compliance to hand hygiene becomes a problem. So first of all, what you need to do is provide an adequate infrastructure, either in the form of a hand rubs or sink. Just providing that is not enough. You have to provide that in ample amount. WHO has defined the amount of swings. For example, if you're in a critical area, such as in ICU or in OT or in even isolation wards, you need one swing for each and every bed. The positioning of the infrastructure is very important. Like sir talked about positioning of the hand rub. The hand rub needs to be placed at an area where you can practice, where you can you can easily access it, or at every point of care. For example, if I'm in an for an ICU bed, it will be the foot end of the bed. And if it is a room, for example, a patient room, then it is at the entry of the room. The reason why we are providing a particular infrastructure or a hand up at such a positioning is so that your workflow does not get affected. The things which you are providing, it should be accessible, it should be functional, and should have running water, soap, and other disposable items, disposable towels, such that. Another thing which you can do if you have a problem where the reason is due to system error is what you can do is you can put visual cues. The visual cues can be in the form of either posters or floor markings. Now, these floor markings on the posters will help guide the staff to reach the hand hygiene station. At the same time, it will act as a reminder to you that yes, the hand hygiene needs to be conducted. Just providing infrastructure, providing stock is not enough. You have to do a regular audit of that. While auditing, the audit can be done by a team, for example, the infection control team, or it can be done by the FMS team. During the audit, you need to check whether the whether it is functioning properly or not, or whether whether it is properly filled or not, whether it's stock out. These are the things which you need to take care of. And always prioritize the use of skin-friendly products, as it helps in enhancing the hand hygiene compliance. Now, coming to the second problem, which is the workflow. You might sometimes see that staff complains that we are not able to do hand hygiene because the sink is far from my location. So you need to optimize your workflow in such a manner that you can what should I say? You can do the things much easily, removing the barriers. If you're working in an ICU, the sink should be nearby so that you can do hand hygiene. Similarly, if due to some reason the sink is not available, what you can do? So in such a case, we have you can take either a mobile sink, or you can even use water dispensers. Other situation, what other things which you can use is hand spray dispenser or a wearable hand rubs. And try to incorporate hand hygiene moments into your SOP. Now, how it will help is, for example, let's suppose we all as a nursing staff, there are checklists. If hand hygiene becomes a part of that checklist, it becomes easier to follow it and becomes a behavior. Now, implementing monitoring and feedback system. If your resources allow you that you can introduce electronic monitoring system, then it's well and good. Electronic monitoring system is nothing but simple hands-free sensor-based systems which capture the amount of hand hygiene product in use. At the same time, it provides a feedback about the compliance. By monitoring, it tells what are the things which we are missing. Just capturing the data is not enough. You need to analyze it. You need to provide a feedback. Now, this feedback can be provided either real time or in a regular basis. For real-time feedback, you can use either app-based method. For regular feedback, you can use email. But you need to make sure that the feedback needs to be provided both to the individual as well as the unit. And the feedback should be constructive. It should not be a fault-finding mission. It should tell the person how much there is an improvement in his or her performance. Always try to find the hand hygiene champion among these people. The reason being, when you it gives the person a kind of positive reinforcement that he has done something good. And by looking at that person, the others also start working out, okay, yeah, I also have to achieve this. And that if that's not even a small bit of gratitude or small appreciation when you go for rounds to the wards, that also goes a long way. Am I audible? Can somebody tell me, please?
Yes, sir, you're audible, but is that possible to increase your system volume, sir? But because still many audience are saying like you're not audible, like the volume is very low, I say.
Okay. Please let me know. Am I audible now?
Yeah, you are.
Yeah, yes, sir. Yes, please go ahead.
So these systems make hygiene both measurable as well as motivating. Culture is something which is shaped not just by policy, but what people see, they feel, and what they believe every day. So if you are expecting somebody to follow hand hygiene, there should be a role model. And if that role model is somebody senior in the staff, then it becomes easier for others to follow. So when the leaders do it, it becomes very easy to tell others or even imbibe from them that we should also follow it. Always build a non-punitive environment where the staff feels that they are safe to speak up and remind each other. For example, if I feel that I'm not doing, or if I feel that I'm not doing hand hygiene, they should be feel free to tell the other person, okay, yeah, you should do it. And always encourage peer-to-peer accountability. Peer-to-peer accountability means if there are multiple people in your group, they can act as a reminder among themselves, and that way that it will go a very long way. Get your departments, there are multiple departments in a hospital, get all those departments involved through campaigns, team challenges, and celebrations, like WHO's Hand Hygiene Day on 5th of May and the Global Hand Washing Day, which is on 15th of October every year. Education. Education is not a one-time event. It needs to be ongoing. It should be engaging and it should be evolving. So always conduct regular training session. And this training session should not be limited only to the classroom. It should be both in the classroom as well as on-site. And this training session should go beyond your theory. They should focus more on your real case scenarios. What you actually see daily, and should be case-based learning. Try to incorporate interactive methods such as videos. Videos are very helpful to train a person if you are doing it in a classroom, whereas demonstrations are helpful when you're doing on-site. So you can demonstrate the steps of hand hygiene, the movements of hand hygiene. You can ask the staff to repeat it. By doing this, you are not only engaging the staff, you're giving that staff the confidence as well as boosting his retention. Always make sure that hand hygiene is a part of your induction program and that all the staff goes through that induction program. It is very important to emphasize that hand hygiene is important from the very day one. And most importantly, always address the common myths and misconceptions. For example, I have come across so many staff who keep on saying, okay, I was wearing the glove, so I don't need hand wash. Please try to tell them that hand wash or gloves is not an alternative to washing hands. Then utilize reminders and nudges. Now, this is very much important for situations where the non-compliance is as a result of a behavior. You might see a person who says, okay, I won't do, doesn't make any change. They're not very much, or for example, if a junior sees their senior neglecting hand hygiene, they do not do. So there are certain behavior aspects of non-compliances in hand hygiene. So in such situation, nudges are very helpful. So what you can do is you can put visual prompts. Now visual prompts can be very simple things. For example, you can put posters, or you can put wall charts depicting your movements of hand hygiene or the steps of hand hygiene. You can put signages telling the direction for the hand hygiene station, or stickers telling forget me not. You can even use mirrors. Mirrors you can place it over the dispenser, and it's written and you can write over it, this is the person who saves life, clean your hands. So when you see yourself in that mirror, it's a kind of a reminder that okay, I need to do hand hygiene. But one thing about visual prompts is you should place it at a very strategic point. If these are not placed at the correct location, the whole message gets diluted. So place it at locations such as at the entry of the rooms or the entry of the ICUs, or you can even place it outside the patient room. And such visual nudges or visual prompts tend to have a very short lifetime. When the person keeps on seeing the same visual prompt day to day, the effect gets diluted. So keep on rotating it. For example, if in an MICU, you have kept some visual prompt, you can, after 2 months or 3 months, you can shift it to surgical ICU. After that, you can shift it to wards. That way, you are able to reutilize the same product, same thing at multiple locations, and at the same time, you're giving the message to different message every time and reminding the person. You can even use voice or auditory alerts. These are bits high tech, but is very helpful, particularly in areas where there is high volume or in critical areas, which keeps on reminding the person as to, yeah, you need to do the hand hygiene. Then you can employ digital screen. Now, digital screen now we have got NABH digital. People are going digital, going paperless. So you can utilize this digital screen. You can put your messages, you can put steps, you can put reminders regarding hand hygiene, and you can place this digital screen at different locations. You can put it in food area, you can put it in nursing station, which keeps on reminding the person that, yeah, I need to do it. Now, this silent this silent act of reminding the person will, over a period of time, will help in developing a habit. Leadership, and last but not the least, nothing changes without leadership support. I think everybody will agree to it. If your hospital leadership is not behind you, nothing will change. So hospital leadership must be visibly back your hand hygiene practices, and should through both funding as well as publicly supporting them. And try to implement your compliance. Your compliance should matter. It shouldn't be just on the paper. Whatever you do, it should matter. So try to integrate that compliance in different manner. For example, you can integrate as a part of a performance appraiser, or you can integrate as a part of a quality improvement goal. That way, it will be something which will reflect on the person what he's doing and whether he needs to improve or not. So when the leader gets engaged, it sends a clear message to all that the hand hygiene is not a one person's job, it's a team effort, and it's everybody's responsibility. Now, I would like to take an example of our own hospital experience. So what happened was, in a particular ward, we saw that the hand hygiene rate was going down for last 3 to 4 months. And we carried out a root cause analysis for that as to what was the reason the hand hygiene is going down. So we found out that it was more of a behavior factor as compared to the system factor. Now, to change behavior is like changing a habit. So it requires multiple reminders. So what we did was, first we installed a 2-hour hand wash alarm. Every area has got its own system. They have got settings, they have clock, and in that clock we have alarm. So we put 2-hour alarm from between 8 a.m. to 10 p.m. Every 2 hours there would be an alarm, and that will be a reminder to the person, to all the staff working in that area, that now you should go and do hand washing. As a result of this, what happened was the hand hygiene compliance rate increased. Also, we were providing regular feedback both on site, telling the person that, okay, yeah, you're doing very good, we were appreciating it, and at the same time we were providing a monthly feedback to the team leaders. So there was an improvement in hand hygiene for a month and 2 months. Then all of a sudden, the third month, we saw that the hand hygiene compliance went down. We again did RC as to what happened. So being Indian, we are over smart. So what those guys did was, they reduced the volume of the alarm. So now, as an additional, we put that checking the alarm as a part of an audit. So every day the team leader used to check whether the alarm is in complete full volume or not. At the same time, what we did was, we tried to emphasize the point by using UV light box. As you all know, UV light box, you take a UV glow gel and then put it in your hands and then wash it and check for the areas where the hand washing hasn't happened properly. So the same we did, and as a result, there was again slight increase, actually drastic increase in the hand hygiene compliance. It went for a month and two, and again it went down. Now we had to use the third method. Now, so what we did was we installed visual cues. Actually, I had shown that visual cue in my previous thing. As you can see here, what we did was these are danglers. So what we did was we put it outside the rooms, and it had a very simple message: forget me not. And there was the 5 minutes of hand hygiene. As a result of this, again the hand hygiene improved. Now, what I want to say is there's no single solution to any problem. You need to be creative. Being in infection control, being an infection control nurse, being a link nurse, you have to think outside the box. You need to be creative about making things more feasible, making things more easy to understand, and making things from what you already have. So that's the point what I wanted to tell. All those what we had talked about in last 10 minutes was more about the traditional method of improving the hand hygiene compliance. But now what we have are the smart solutions. Now the smart solutions are kind of a solution which help to automate, remind, and reinforce the hand hygiene behavior. And here are some of the solutions. The first one on the left one, is the smart wearable. This smart wearables come in 3 ways. 3 types. One is the band, one is the clip-on, and one is a band, clip-on, and patch. Sorry. So what happens is this thing is based upon the principle of magnetic induction proximity sensor. So if you're wearing one of this and you approach an area, a patient care area, the sensor which is on the top will provide a nudge, a reminder to you if you do not do hand hygiene within a specific period of time. For example, you entered an area and within 10 seconds, you're not doing hand hygiene, it will provide a nudge or a reminder. This can be in the form of vibration or a change in color. Now, the second system is the voice cue touchless system. It is a very simple system where the touch-free hand dispensers have got pre-recorded voice messages. So as you come in proximity to a patient care area, or so it will provide you with voice messages, a reminder to carry out hand hygiene. Now this is an AI-powered video surveillance, the third one. So what we do here, this is based upon the principle of data analytics and machine learning. So the camera has been trained to look for the different opportunities. Of where you should do hand hygiene, and whether the steps of hand hygiene, all the steps of hand hygiene have been followed or not, and whether they have been followed properly or not. So this is something, and I just was talking to one of my colleagues, and they said that they are trying the same thing in their institution. So I hope to see as early as possible regarding that. And then we have the visual lighting cue hand hygiene dispenser. Now this is a very similar kind of dispenser. Only thing is here it has got flashing lights. Now because of the flashing of the light, it gives you a reminder. And whenever you go near to that area or near the patient care area, it gives a nudge or a reminder that, okay, I need to do hand hygiene. So this is another thing. And this is one step ahead, where apart from that, it gives a behavior beacon. So that it gives you a reminder that you need to do hand hygiene. If you do the hand hygiene, it will give you a smiley. So it's a kind of a positive reinforcement to the person. Okay, yeah, I did something correct. There was a reward. So if I have to summarize what all I talked about, and the key takeaways from my presentation today is understand the barrier. The barriers may not always be due to the knowledge. It is usually either due to the systemic factors or due to the individual factors. Address both individual as well as the system level factors through targeted strategies. Make hand hygiene easy. Do not make it complicated. Keep the things visible, keep in proximity, keep in patient care areas. Monitor, audit, and give the feedback regularly. And most importantly, give a positive reinforcement. And invest in training and culture change. Adopt smart innovation. And as I always say, engage leadership at all levels. If leadership is not involved, whatever you do, whatever you may try, it won't happen. So to conclude, I would say that improving hand hygiene is not a one-time initiative. It's a long-term, patiently done and culture-building journey, which requires collaboration of infection control, collaboration from nursing team, administration, and our frontline staff. Thank you. I would, if there's any question and answer, I'd like to take it now.
Yeah, yes. Thank you so much, Dr. Sagar. This presentation is very amazing, and it shows like you are the person like how keen in making the healthcare professionals to be like very professional in doing the hand hygiene. Because as a nurse educator, I have educated all the professionals do the hand hygiene, do the hand. You have moved far ahead. Implementing the AI powered surveillance and all. Like I was so amazed to look at all the presentation, like giving the reminders to the healthcare. Nobody can escape without doing the hand hygiene, can reach the patient. That is what you're like reminding us about. Thank you so much, sir. Thank you so much for sharing your experiences here. Before the Q&A session, I have one announcement to us. So can I share my screen, sir, if you would? Yeah. So much. Yes. So before the Q&A session, I would like to give an announcement regarding our upcoming Friday webinar series, which is our Skills for Med series, which is supported by the Healthcare Sector Skill Council. We have 4 weeks of webinar, which is like the first week we are like focusing on elevating standards to achieve excellence, and the topic would be like August month would be like about like what to flag to the doctor immediately when you receive alert or the lab reports, critical alerts. And second week we are focusing on how to organize ourselves and our workplace, and the topic would be like regarding the busy shift blueprint, how to prioritize the task when everyone need you at once. So which is a challenging part for all the nurses when they work in the during the duty hours. And week 3 will be focusing on learning from errors and incident reports. That is mainly focusing on how to do the brainstorming, taking one incident as a focus point, and how to do the brainstorming, root cause analysis, and corrective action, preventive action. What are all the fancy terminologies here in aspects of quality? We are here to teach you and guide you through that to how to overcome that incident part. And in the week 4, that is the most interesting part, is about like inspiration and insights from nursing leaders. We usually welcome one of the CNOs from anywhere in part of the India, and then we asking them to deliver their personal experience, how they become a leader. And these have motivated a lot of nursing professionals, young generation who actually aspires to become a nursing leader. So this is about our announcement, and related to this webinar series, we'll be sharing the QR code and the link equally as we were doing so far in our WhatsApp group, and also equally you will receive the mail. So all the participants will get updated about our webinar activities. Thank you so much. So let us move to the Q&A session. So Dr. Pari and Dr. Sagar, so can we take the Q&A session now?
Yeah, please.
Yes.
Can
So
start.
there is the first question here. How can we select the hand hygiene samples in the hospital? Do we have any formula?
Uh, as in samples, as in like to select one among few like that.
It is just a generic question they have asked for, doctor. Do you have any like?
Okay,
I
so
think
follow
that probably
protocol.
means how to audit, and I don't know.
Yes, I think so. It's how to audit the hand hygiene probably.
The formula, no, I mean
Yes.
I think the WHO audit thing has the formula. So I don't know. Um, can we move to the next one and then
Yes, yes, yes.
we
We
can
could
ask
probably help them.
Hema Kumari to probably even unmute herself and ask that question so that we can understand the question better.
Yeah, sure. Hema Kumari, you find some time to know. You can put forth your question directly by raising your hand. We can facilitate that. So the next question is like how to monitor an electronic monitoring system. Can you give some details? What is this actually like? How to monitor on electronic monitoring system? It is automated. Am I right, Dr. Sagar? Like,
Ask is how does electronic monitoring system help?
Yeah.
The automatic system. So it usually the monitoring system, like I talked about. So it's mainly based upon, if we check, it's mainly talking about the movement 1, 4, and 5. These are the three movements where we find most. If I put a poll also, I think 90% of them will agree that these are the three movements where we will have our non-compliances the highest, the movement 1, 4, and 5. So most of the monitoring system, like the variables, are based upon this only. So they actually check whether the person is carrying out the hand hygiene at the entry and at the exit. And this data gets captured and gets analyzed and is presented in a real-time manner, live manner to a central team or the team leader, or depending upon the kind of software it is.
okay. Thank you, doctor. And there is another question like how can we improve the culture of hand hygiene among doctors?
That's where it comes to behavior.
Okay.
The simple thing is what we say is chai pe charcha. So you can make them sit. So that's one thing. First of all, what happens is most of times it is more of a habit. It's like a doctors are busy, so they have to look after multiple patients, and doing hand hygiene between each patient is something which is both cumbersome and not a part of their daily routine or habit. So what you can do is a visual cue, a simple reminder, which can help them. Okay, I need to do so. Depending upon your resources, you can put something like a uh, bobblehead kind of thing on at the entry of all rooms, or you can use simple anything visual which makes them remind, because auditory is something which is more of a resource. It's more resource oriented. So simple things. It's a 5 rupees, 10 rupees thing I have seen where people have used chart paper and color and have put it. They have given kids as a project. The kids at home, our nursing staff kids at home made it. We one did a kind of competition for them, and now we are using it. So a simple, very generic things we can use just to remind, just a reminder what is required.
Thank you, doctor. And there is another question like, is it necessary
Stella,
to
can
take?
you just
Yes.
tell them that the feedback link is in the chat.
Yes. So this Q&A session is like ongoing. So there is a feedback form link in the chat box. You can click that link and then fill the form. Only if you fill the form, you will get the like participation certificate for this webinar. So thank you so much. So we'll go with this Q&A session. There is another question like, is it necessary to take 200 opportunities for hand hygiene audit?
200 opportunities for hand hygiene is more about the significance of that, actually. So it depends upon your size of the area or the size of the hospital, you cannot do the same for a 30-bedded hospital. So it depends upon how big your hospital is. And opportunities, if we see, rather than concentrating on opportunities, you should more focus upon whether the person missed it intentionally or unintentionally. That is the most important thing. Sometimes it happens is you cannot expect. Now in India, we are having a attrition of nurses. You cannot, a nurse is taking care of multiple patients. Giving a feedback, okay, you didn't do hand hygiene, will not be will not create a positive environment. So you need to first, what is ACE? That is, you need to first empathize, you need to communicate, and you need to appreciate. These are the three things. If you follow these three things, half your problems regarding hand hygiene will get solved. So first find out why it didn't happen. Appreciate them for what right thing they did. So all these are important things which you should follow.
Thank you, doctor.
I think
And
that's
yeah.
a very, important message here, because most of the time, we sort of look down on people who didn't, do the hand hygiene, and that puts them on defensive and, in a negative mindset. So I think what Dr. Sagar suggested is very, very, practical and useful.
Yes, and there is another question like these are like usually I've heard as excuses that they're asking like, what about if someone affects their hands by frequent hand washing? Any alternative?
You mean to say the product which they are using is like allergic or that means
Not for the product, doctor. I think so. Like usually when we ask them to do the hand hygiene, no, my skin getting dry, I cannot do on and off, like all those excuses. Like if really they get the effect because of the hand hygiene, then do we have any suggestion for them or any alternative for that?
use moisturizer or emollients. That's the only thing I can talk. Because it's mainly due to dryness. If it is something like that, that's the only thing you can do.
Yes, and there is another question, like as you were like talking about the digital aspects, I think they want to put forth this question. Can we use any apps for audit the hand hygiene?
Yeah, there are multiple apps which are available in the market, which can be helpful, and they can be utilized as they provide you more of a live scenario, a more real-time feedback as to what is happening. So yeah, they are available, and it's a good investment.
And how to do the surveillance for hand hygiene for our night duty staff?
What I always say is all our duties are in rotation. So if the person is not doing hand hygiene in a particular time, then it is behavior. But if the person is not doing hand hygiene at all, it's a habit. So what you need to understand, I said it wrong. If the person is not doing at a particular time, it's because of the workload. But if the person is not doing always, it's a habit. So if the same person is not doing hand hygiene at night as well as in the morning, you need to work upon his behavior, his or her behavior. If the person is not able to do hand hygiene at a particular time period, for example, at night, you need to find out what's the reason. It might be because of high workload.
Okay. And there is a long one here. Miss Evelyn have asked this. The time for regular hand washing with soap and water is 20 to 30 seconds as per WHO, and 40 to 60 seconds using hand sanitizer hand rub. Is still accepted? She's asking this question. I think she have no vice versa that. And the main question is like, and the 6 steps of regular hand washing posters or guidelines vary. Like the concern is about some include the wrist in the last step and some does not. What is the best to apply since we need common one in the facility?
Actually, it all changed. The WHO changed it in 2016. And the reason what I got is after 6 steps, if you touch the wrist, you will be contaminating your palm area. So that's the reason why it was been removed. So that's only for hand rub, but for hand wash, you can do the wrist. There's no problem.
Okay, I think Evelyn, you might be like cleared from your doubts from now.
6 steps. Yes. 6 steps is, but the problem is the older videos and older posters are still circulating. That is what is causing the confusion.
Okay, yeah, I think that was the question concern about that also for her. Like, okay, and we have done with the this side. I think in the suggestions in the comment box we have some question. So they're asking like for auditing, is that manual is better or digital is better?
Combination is better. That's what I
Combination.
say. The reason being digital have its own cons, there are its own fallacies. Digital will always look at the more of a binary way, yes or no. Whereas when a person is manually auditing it, you need to see the situation also. In Indian context, definitely you need to have a manual intervention, or else it will go haywire.
And okay, so there is a thing. Okay, that is actually for Shulke. There, someone have thanked for that automatic dispense or something. Like, and there are like quite similar questions, Dr. Pari, like, the difference between the day working nurse and night shift nurses,
Yeah,
what measures
yeah.
can be done. It's already answered. And or should we consider wearing gloves instead of doing hand hygiene for the compliance rate? This is all repeated question, like when we usually take this session, like,
I think, yeah, that's right. I think Dr. Sagar did mention that in
yeah,
his talk as
he
well.
given the answers. Okay.
It's not an excuse. Wearing a
Yes.
glove is not an excuse to not to do hand hygiene. Please, that message should go across.
It is more
Yes.
necessary for hand hygiene, because by removing, you will be contaminating your hands.
Yes, yes. Always don't have such query in your mind, like, no, hand hygiene is really very important. No, it is, don't compare that with a glove. Like, and another question from Sharal is like, what to do in decreased in hand hygiene complaints?
First, do the RCA. Find out the reason why the compliance is less. Is it because of the systemic, or is it because of the individual factors? It's behavior or non-behavior. If it is something related to systemic, then you need to work upon it. Something like what I talked about is infrastructure. You need to improve your infrastructure, your accessibility. Or if it's due to behavior, then it's more about giving reminders, nudges from time to time. Okay, you need to. That's the only way.
Thank you, doctor. And is there, I think I
Yeah,
have covered up
I
all the
just want
questions.
to ask this question because I found this new thing, especially in the junior staff, also some doctors, they wear the hand glove and then they do the hand rub on top of the glove, right? Saying that this, it doesn't affect the hands. So my argument is the hand rub has to dry, right? I mean, and I don't know it was intended for the gloves, it was intended for the hand. So that's the argument I gave. Is that, can you give your views about that? There are innovatives in ways in which they avoid hand hygiene, Is you have to find new ways of countering that.
That's what I said. We put a 2-hour alarm and they decrease the volume. So we need to always think out of the box. But it's always a ongoing process. You have to think always out of. There's no one answer to a question. There's no single answer to any question.
Yeah.
And another participant wanted the suggestion from you, sir. Sereng Lamo. Like, is there any like comments on use of hand dryer inside the ICU? Hand dryers.
Dryer meaning what? Like the ones in
I
the
think yes,
malls?
yes, yes. Malls like, yeah.
Okay.
Dr. Sagar is there?
I think his network is.
Yeah, network. Yes.
We can't hear you, Dr. Sagar. I think he's shocked by that question. He's frozen.
Network. Which hand hygiene audit app is the free? Is like Suganya madam, you know to check in depth about that. Like, we don't have any suggestions for that. These are like common questions, like before Dr. Sagar could come, so we can handle those. Frequent hand hygiene with hand sanitizers affects our body. I think already it is mentioned, no, sir? Like,
Yeah, there's no, I mean, it's just like the cell phone scare, no?
yes.
You keep the cell phone in your pocket, you're going to get heart attack and things like that. It's the same thing. I mean, I don't think it affects the body. It's on the surface.
Yes.
It doesn't get absorbed. So these are all excuses given not to do hand hygiene. And now if you're going to believe it, then it's going to be a problem. So we'll just wait for Dr. Sagar to come, or
Yes, I think he have come now.
yeah, he's joined.
Dr. Sagar?
Sorry, I got disconnected.
Yeah, I
No
thought the
problem, sir.
question about hand dryer in the ICU shocked you so much that you know left the meeting.
So what was the question? Sorry. Uh,
No, the malls you have this hand dryers, no, after in the toilets and all.
yeah.
So they were asking whether they can put that in the ICU.
No. Very specific hand dryers only in public places and only hand towels. There's a very specific reason as to why we cannot use it. Because what they found was when we are drying with hand dryer, the creases of the hands, they do not get that they tend to remain moist. They do not dry up properly, and hence better to use paper towels.
I think that is
Yes.
that's a, that none of us could have answered that question.
Yes. I think we have done with the questions, sir.
You can ask Dr. Rajaram, Mr.
Yeah.
Rajaraman to give his
Yes.
remarks.
Okay. Thank you, Stella. Thank you, Dr. Sagar. And great. Quickly, actually, it's not time to say thank you for all of you to have been here all the 5 weeks, listening to experts. So basically, this series we named it as From the Front Lines, in bringing about the best practices in patient safety and infection prevention. So this 555 series, we listened to 5 thought leaders, 5 success stories. And actually the journey has been so celebrating. When we planned, we thought maybe we'll have about 200 people and then we'll celebrate. Actually, we have been so excited that every meeting, every session, we clocked more than 600 plus people. I think very great thanks to all of you for making it happen. I think the aim of this program was to share insights from the front line, to spark some dialogue. I think every session we overshot because there was so much of question and answers to the speakers. I think the discussions were very inspiring and very thought-provoking. This, of course, with the response from all the participants, I think we definitely have to acknowledge that the stories have been great innovation success stories and stories of resilience about how to change behavior, how to bring about change in the institutions. I think great work done by the thought leaders. Definitely, I need to show our gratitude and acknowledgement, our sincere thanks to all the expert speakers. Dr. Pari leading from the front. First session we had Mr. Vinod from Medanta Hospital. Then we had Ms. Sai Bala from Amrita Cochin. Then we listened to Vidya Mani from Apollo Chennai. Then we had Captain Madhukari joining in from Calcutta. And then now we have Dr. Sagar from Pune. I think everyone shared their time and wisdom. Really need to appreciate their efforts. Thank you very much, Dr. Pari and Dr. Sagar here.
Thank you.
And the others in absence. To our audience, I think doctors, nurses, healthcare workers, you are the real heroes. You have been here listening, and I think your innovation ideas, I think, has been really kindled upon. I think you can do a lot better now. And definitely, I need to show appreciate the work of the Skills for Med team, Jayanti and Stella. I think they did a great job in coordinating and getting things organized. Together, I think we made the learning from the front lines accessible and inspiring. So I think I just want to leave you with a thought that which we follow at 𝐶𝐬𝐭𝐢𝐴 is that the KISS principle. So when we attend any training programs, and this is one thing we follow. So keep doing what we are doing good, increase doing something which we feel is important. Start doing. Suppose if there's something new we picked up, I think we should start implementing immediately so that we get it onto the improvement stage very, very quickly. We have to stop doing it, because if there is no point doing the same thing, so doing the same thing and not getting results is not going to be helpful at all. So if we have to raise from ordinary to extraordinary, I think there's a lot of work to be done. So we don't expect you to do extraordinary things, as Sagar said, and Dr. Pari has been repeatedly saying the leaders set the stage for performance to improve. But I think as individuals, everyone can do ordinary things extraordinarily well. And the attitude we should carry is something like this: give me a liver long enough and a place to stand, I can move the earth. I think that's a positive mindset we should have to bring about change, especially with respect to infection prevention and patient safety. With that, thank you all very much. I think time to be happy. So give your best efforts. Thank you all once again. Over to you, Stella.
Thank you, Mr. Rajaraman. I think here
Thank you so much, sir.
please, our gratitude to 𝐶𝐬𝐭𝐢𝐴 for supporting this series of webinars, and Mr. Rajaraman for coordinating and leading from the front. Thank you so much, Rajaraman, and thanks to your 𝐶𝐬𝐭𝐢𝐴 colleagues as well. Thank you.
Thank you very much.
Thank you so much, everyone. And I'll be there, Dr. Pari, until the participants are filling their feedback link form. Thank you so much, Mr. Rajaraman, and thank you, Dr. Sagar, for a good